My name is Edward Shields and I'm an orthopedic surgeon at Orthopaedic Associates of Muskegon. I treat conditions of the shoulder, elbow, and hand. I actually completed a shoulder and elbow reconstruction fellowship, so I'm very comfortable with complex shoulder pathology such as difficult primary and revision shoulder replacement surgery, primary and revision rotator cuff repair, shoulder fractures, instability, as well as a new thing called superior capsular reconstruction for rotator cuff tears that are just too large to be fixed. I also spent some extra time during residency and fellowship studying hand surgery, so I'm very comfortable with treating traumatic and degenerative conditions of the hand. I chose orthopedic upper extremity surgery because I always found the anatomy fascinating in the hand, forearm, and shoulder. It's also a nice blend of trauma, sports medicine, soft tissue, and arthroplasty procedures. And in general, orthopedic patients tend to do very well after surgery, whether it's a fracture that we've stabilized or an arthritic joint that is replaced. These patients typically get significant relief and do very well, which is rewarding for both the patient and the surgeon. I strongly encourage my patients to exhaust all non-operative treatment strategies early in the course of whatever pathology they're experiencing. So my role as the surgeon is to discuss the pros and cons of these treatments and try to guide them to what I think might work best for them in an attempt to prevent surgery. When these measures fail, however, we have an open discussion regarding the risks, benefits, and the recovery differences between surgery and continued non-operative treatment, and then I allow the patient to make a decision that fits best with their long-term goals and expectations. My successful patients have taught me that with perseverance and determination, they can successfully overcome almost any injury or pathology they're experiencing. It's made me realize that encouragement and support are equally important to patients' recovery as much as any intervention might be. Most of my time is spent with my wife, who's a radiologist here in town in Muskegon, and our 2 children. I'm a big college football fan. I run and play racquetball. I've also done a lot of research in the past on shoulder surgery, and I'm planning to continue that to some degree here. I was born here in Muskegon, actually, at Hackley Hospital, and attended Whitehall schools, so I just love being back where I'm from originally. The majority of my family are still here in the area. The people in this area are just down to earth, hardworking, and really just want to get better, which makes my life as a surgeon a lot easier. It's also a beautiful area being so close to Lake Michigan and a great place to raise a family.